Kia ora! We're on a journey to transform Aotearoa's approach to mental well-being and addiction, so New Zealanders are supported to stay well and have better access to help that works for them when and where they need it. Here are some highlights from the April to June quarter. Almost 152,000 sessions were delivered by the end of June. Around 11,000 people per month were accessing support and services from health improvement practitioners or health coaches and support workers. Contracts are now in place with all DHBs. At the end of June, 237 GP sites were offering services, and the phased rollout of services is underway in 16 of 20 DHB areas. At the end of June, there were 12 contracted kaupapa Māori services, and almost 300 people were using the services each month. When it comes to the needs of our Pacific people, we signed contracts for 9 services in 7 DHB areas. Almost 5,000 sessions were delivered and more than 480 people accessed these services. There were 18 youth services contracted, including expansion of the national telehealth web chat service delivered by Youthline. More than 14,000 sessions were delivered by the end of June. More than 790 young people a month were seen through these services. Around 96,000 students in almost 300 decile 1 to 5 secondary schools now have mental health support available. That means students can have more one-on-one conversations with a nurse to support their mental health and be connected to other support services if required. Rainbow competency training for mental health and addiction professionals started this quarter, so they can better understand and address Rainbow community needs. 23 scholarships were awarded for Pacific students. 44 new bursaries given for Māori students. 82 new entry specialist practice positions were filled across social work, nursing and occupational therapy. 156 practice nurses chose to specialise in mental health. Work started on the transitional housing project, supporting people from acute mental health units into housing. We conducted a stocktake of the maternity mental health services provided by DHBs and supported Wharaurau to upskill clinicians to work with people with eating disorders. All DHBs have been contracted to partner with iwi and work with all stakeholders to design projects that will transform existing services to better meet local needs in ways that work well for people using them, and we've been building capability for better and faster change across the system. We added new community services in 2 DHBs and a new managed withdrawal home in community service and peer support in Lakes DHB. New pregnancy and parenting services are now available in Whanganui and the Bay of Plenty. Contracts are in place for ongoing Māori and Pacific suicide prevention community funds. Ao Ake Te Rā, a national service supporting the bereaved, is now being delivered by over 60 providers across 13 DHB areas. We're committed to ensuring New Zealanders are supported to stay well and continue to have better access to support that works for them when and where they need it. Until next time, ngā mihi nui.